We'll call the Health and Human Development Committee to order. Madam Clerk, could you do the roll call, please?
Alderman Vollmer.
Present. They moved my mute thing on. They did an upgrade, and it used to be on top. Now it's on the bottom.
Alderwoman Tyus. Alderwoman Schweitzer. Alderwoman Tanya. Chair Boyd.
Present.
Alderwoman Tyus. Alderwoman Schweitzer. Alderwoman Tanya. We have 2 present. We do not have quorum.
All right, thank you so much. Today we're going to have discussions for senior services, and I have a young lady that will be on long-term care and how it's impacting our city, and kind of give us a brief synopsis. We'll probably ask her to come back to give us more detail, but I just thought it was very interesting because whether people believe it or not, it intertwines with the homeless piece in our city. And so at this time, I wanted to introduce Miss Nancy Stevens. And so she is a representative from various city and community agencies, and she will be discussing long-term care. So, Ms. Stevens.
Will you swear her in?
Yes, ma'am. Ms. Stevens, will you swear that you tell the truth, the whole truth? Oh, raise your right hand. I'm sorry. Will you swear that you tell the truth, the whole truth, and nothing but the truth?
Yes.
All right. Thank you so much. You may proceed.
Okay. Well, I was asked to come to begin addressing some of the issues with long-term care, some of the reimbursement issues, some of the processes that are affecting the success of the city nursing homes. It has a significant impact on the county also, but more importantly, I was focusing on the city because I recognize some discrepancies in the reimbursement rates for the city nursing homes. So several of the homes that had closed over the last 2 or 3 years, I was actually doing some work there at those locations, and then tried to work with some of the owners to recoup some of their fees, to try to get involved when there were issues with civil money penalties, and when it was time to contest some of the issues. So I'm going to give you like a brief synopsis of what happened prior to COVID. And I know that everybody I use that only because it's a good marking point. It's not the cause of the decline. It was just a place and time that we all recognize, and we all remember that time. Prior to that, healthcare and long-term care particularly struggled with having access to adequate staffing, and adequate services to support the nursing homes in the metropolitan as well as some of the rural committees. I work all over Missouri and Iowa and parts of Illinois and a couple of the other surrounding states. And Missouri seemed to get hit the worst of all the surrounding states. When COVID came, then the staffing had worsened. And so what happened is, normally in a structure in a long-term care facility, you have an administrator, and then you have a director of nursing, and then a few other department heads, and then the rest is first-line staff. Isn't a very large chain of command because most of the people are hands-on workers. So what happened was, usually in those facilities, one or two of the positions, the administrator namely and the DON, tend to be the higher paid positions in the nursing home. What happened then was that the cost of getting one nurse, one LPN, one RN, one CMT became either 50% or 100%, or in some cases 120 or more percent of the actual top paid positions in the facility. The structure of the reimbursement rate was never high enough to accommodate those costs. And so what happened as time went on, the situations worsened, the money became tighter. And interestingly enough, the civil money penalties became heavier. That we started seeing civil money penalties to the tune of $250,000 and $500,000. So money, the constituents saw, all you see is the reimbursement, right? But what you didn't see on the other end were the people that were drawing money out of the facility unrelated to providing care, in addition to civil money penalties that facilities were getting. So I'm going to zoom in on the city, because what happened is I grew up in the city, lived in the city until about 20 years ago, 25 years ago. My children still live in the city. My son has a large business in the city. I have, my family, a lot of my relatives lived or worked in the city. And my church is in the city. I have a significant interest in what goes on in the city. So what I noticed throughout the state was that the reimbursement rates had changed. So there's two forms of the reimbursement that are directly government funded. One of them is Medicare and one of them is Medicaid. Medicare is for short-term reimbursement. It's usually because you have a family member or a parent or a person who was had some hospitalization or some acute care illness, and then during the period of recovery and therapy, that money is given. But it's only a short-term amount of money, and it's evaluated on an everyday basis to see if there's any improvement in that person's care, and if so, then the reimbursement will continue. On the other side of that is something called Medicaid, and that is what most of the city nursing homes survive off of. They do have some Medicare, but they're predominantly Medicaid reimbursement in their Medicaid facilities. So what happened was the Medicaid rates changed. They became very complicated. They used to be a set number, but many, probably 4 or 5 years back, what they did was they set it up on more of a matrix. So there were a multitude of things that had to contribute to how much your rate was going to be. That became a little complicated because the staffing, everyone was unsure at the time how those numbers would impact, and also the contribution of the type of residents or the type of illnesses the residents had, how much that would go into the reimbursement. So what happened was the rates were established, and that's what the facilities got if they're a Medicaid facility, they're living off of that amount of money for each resident every day. So to give you an example of what that might be, is some facilities get $165 a day for a Medicaid patient, or they get $180. So if you actually break those numbers down and think about, that money requires housing for that resident. It requires their over-the-counter medications. It requires them to have a CNA or a CMT, a CNA that would be taking care of their activities of daily living. It includes them having a nurse 24 hours a day, or the availability of a nurse 24 hours a day, along with all the support staff. So if you think in simplistic terms, if you went to a hotel and rented a hotel room and then tried to back out those fees for all your food, for your over-the-counter meds, for your additional care, for someone to do your laundry, housekeeping, all those security services, all those additional services, you could see where $160 to $180 a day is not going to cover the cost. So what happened was it hit the facilities, and then they started struggling. And because at the same time, staffing costs increased almost to the tune of 25 to 33, and in some cases 50% more of what they were paying before, there was no way that they could stay in business. And so they held on because some of the owners actually are from Missouri, and this was their family-owned business, and they tried to keep the facilities afloat. But in a lot of cases, they just eventually shut down. You saw what happened in Northview Village, the Riverview. The owners of Dutchtown had to sell. There were other facilities that have closed within the city proper. So in an interest of promoting that at the state level, I took the Medicaid rates and tried to sort out where the majority of the money was given, and took a look at the city nursing homes to see why they couldn't stay open. Like, what kind of things did we need to bring to legislators' attention to try to get some remedy from this? And I noticed along the way, now I haven't done the updates because a new pattern of reimbursement just came out. It's not much different, but nevertheless, in the previous one, what I did was sort out by county and city, and which facilities were in the middle, like the city proper. I haven't sorted out by wards, but I think that would be an interesting thing to look at also. In where the rural areas, some of the rural areas receive the same reimbursement as some of the city homes, even though the cost of living in the city is higher, even though some of the city, or a lot of the city homes, have security systems and have other kinds of things that aren't similar to what you would see in a rural area. They were in fact getting reimbursed similarly or less than some of the rural areas. So I put together the pattern to see what had happened, and I noticed not only was Missouri number 50 in the country for Medicaid reimbursement for their skilled nursing patients, St. Louis City was actually the lowest in Missouri as a grouping. Now, I didn't look within the wards, but that would probably be an interesting thing to look at. And if you want to, and you want me to come back and do any other presentation, I can sort those out for you. But I got to wondering, how do you tackle something like that? Well, it's not only a statewide issue, then in addition to that, it's also a citywide issue. And I saw during the time some of the nursing homes were shutting down that the focus was on the owners as opposed to the focus being on the reimbursement. And so Pam, Alderwoman Boyd and I had talked multiple times about what was going on with some of the facilities, and why do they feel as if they're in this chokehold with being able to keep their residents taken care of. There are probably in the near future, I would say in the next 2 years or less than that, you're going to see some additional facilities shut down because they cannot stay, financially, they can't subsidize this healthcare issue. I hope I'm not confusing everybody about that, but that's the situation. But I did want to add one more thing. In addition to that, if you have a family member or someone from the hospital who is getting discharged and they need a Medicaid bed, in order to get a Medicaid bed, they have to be on Medicaid. And a lot of times they are not signed up for that type of Medicaid. So what happens is the nursing home, in good faith, takes the patient, and then they have to apply for something, it's called Medicaid pending. So they have to apply for Medicaid. They have to do it through this very complicated system because the state has layered up between the federal government and the state, they have layered up additional requirements for you to qualify to get skilled services and to get your reimbursements. So some of it's a system called COMRU. And what happens is once you get a resident in the facility, there is no reimbursement for that resident. So let's say a nursing home admits a resident, takes the resident from the hospital on a Friday. So then they start trying to qualify them for Medicaid. So then they go into a status called Medicaid pending. And what happens is the social worker, along with the other clinical staff, have to produce a document and submit it through the portal through through the state of Missouri. That is backed up in some cases up to 6 months. And so that means that facility goes without any kind of reimbursement during this time. About 6-8 months ago, I gathered all the facilities that I worked for, in addition to some that I don't, some of the owners, and we pulled all their Medicaid pending. And in some cases, some of the facilities had Medicaid pending up to and including close to $3 million. So when you put that kind of a burden on a cluster of nursing homes, in addition to the fact that the reimbursement rate isn't adequate enough to support them, that is why you're seeing the fall of the nursing homes. And now what I've seen happen in some of the nursing homes that have closed is then the unhoused people move into that area and move into the property. The property gets vandalized. People take housing on the side of the building or inside the building if they can get in the building. And it's such a security issue and a safety issue that the services in the city can't help support to do anything about it. So it creates a whole nother dynamic on the other side. It's just not a matter of the nursing home shuts down, the residents all get displaced, and which is an extremely sad event. It's like your house being shut down one day. You're surprised. You have 30 days to move out or find another location. And then all the staff there have to find another location to work. Then what happens is there's a whole nother side of it where now you've got a property that has a 3- and 4-story property that has no one in it. And even though the owners or the past owners try to provide security, it's a near impossible feat. I've been involved in this for several years, and I've seen it take a pretty hard hit in St. Louis, inside the proper St. Louis, and you just see the things around it worsening. So any more than this probably is going to get more complicated. And if I don't know how much interest there is in it, but I had talked to Pam previously, or Alderwoman Boyd previously, about maybe the focus needs to come out of the city. I've gathered owners of nursing homes together, and we've had audiences multiple times with some of the state reps. And then I thought maybe it would be pertinent because the city is getting hit so hard, maybe it would be pertinent that this be brought to the attention of the Board of Aldermen, and perhaps as a group, they could have a voice in some of this, particularly because your reimbursement for your patients in your city is not only Missouri is the lowest again in the country, and St. Louis is the lowest in Missouri. Now, I'm going to qualify that with the new rates just came out. They don't look much better. They are a little bit better, but I didn't sort them according to which county and which city, or whether it was Kansas City or St. Louis, which ones. I didn't rate those accordingly. But I do plan on doing it. I just haven't done it as of yet. But I didn't know if there would be any interest in doing something or having more conversation about this. But unless there is attention drawn to it, this situation is just going to worsen. And I do some work with the unhoused at Biddle House and some of the other facilities. So, you see the other side of that, what happens when this other system breaks apart. And if there is interest, I'd like to bring more of it to your attention in a more organized format so that you can actually see the numbers and see where St. Louis is ranking in relationship to the state of Missouri. And then in addition, it is really an eye-opening thing for everyone to see where Missouri ranks in terms of healthcare. So no matter what anyone says, they will promote it as if Missouri is the best in class. I've watched all the hearings. Okay, so they will promote it as if Missouri is the best in class. And when a definition is requested of that, they'll say we're better, or we're at least as good or better than the states around us. Well, my group and I have pulled all those states around us and their Medicaid rates, and that is totally not correct. And so we can't be portrayed as the best in class when all the financial institutions are mapping us as number 50 in the country. So it is a problem. It needs to be addressed, whether it's addressed now or addressed at a different time of this decade when things worsen. I thought the aldermen would be interested in it only because it's severely affecting your wards. And if you haven't been hit by it yet, you will eventually, because there are owners that are trying to rid themselves of some of these facilities.
So,
Anyway, I think that's pretty much it, Alderwoman Boyd, but if you have any questions.
okay, thank you so much. So now we'll ask for questions. Alderman Bomber, do you have any questions for Ms. Stevens?
No questions. Thank you. It's very informative and very, unfortunately, a very bleak picture that's being
It
painted.
is a very bleak.
So thank you for bringing that to our attention. Thank you very much.
You're welcome.
Alderwoman Sonia, do you have any questions?
No questions, but thank you so much for your service.
Thank you.
Really appreciated the detailed testimony.
Thank you.
And so, Madam Clerk, we still don't have a quorum as of yet, correct?
We have 3. Yes, ma'am.
Okay. Okay, that's what I just wanted to make sure. And so, Ms. Stevens, what we'll do, and I'm very glad you kind of gave them the prenup of what is going on in the long-term care. And so that's why I included her resume into the drive so you all can see her expertise and what she has worked in. And I think what it is, and I had a brief conversation with Alderwoman Sonia about this. And so it's not just about long-term care, it's the homeless is a part of this also. So it's all intertwining together. And I think what people have to understand is the long-term cares were not set up for what they're dealing with now. They weren't set up to take the homeless, and they weren't set up to take the mental ill. And so now they're challenged, and I think that's having an impact also. So I appreciate this, and we do look forward to more conversations, because as this health committee, it's importance for us to address the health within our communities. And so long-term care and homelessness is part of health in our community. So thank you so much, Ms. Stevens. Did you want to say any last things?
No, but if I would like to, once I sort out the new updates to the financial information for the Medicaid reimbursement, if I will forward it to you, and so, because I think it's important, and if I can get the distinction of the wards from somewhere, and I can work with you about that, maybe I'll break down.
I'm sorry. I don't mean
Yeah.
to interrupt. I'm
Okay.
sorry. Alderwoman Boyd,
Yes, ma'am.
Chair Boyd, there is an emergency. We have to leave the building.
Okay.
The alarm is
Okay.
going off.
All right. Thank
Okay,
you.
thank you.
Bye-bye.
So,
Alderwoman, you can just
Mr.
pause.
Kennedy, how do they want to stop, tell them to stop the meeting and resume the meeting?
Take a break.
I'll now call the Health and Human Development to reconvene at 9:53 a.m. Madam Clerk, would you please call the roll?
Alderman Balmer, Alderwoman Tyus, Alderwoman Schweitzer, Alderwoman Sanye,
Present.
Chair Boyd,
Here.
Alderwoman Tyus, Alderwoman Schweitzer. We have 3 present. We have quorum.
Okay, thank you so much. thanks everybody for holding on through our emergency. And so now we're going to start back. And so we have on our agenda the mental health board nominee.
What- I'm sorry, Alderwoman Boyd, we have quorum, so you can go ahead and take the vote on the minutes.
Oh, okay. All right. So I'll ask for approval of minutes for what was it, January the 16th?
Yes, ma'am.
For January the 16th.
So moved.
Second,
Roll call.
Alderman Varmer, Alderman Varmer,
Hello? Aye?
yes. Alderwoman Tyus, Alderwoman Schweitzer, Alderwoman Tanya,
aye.
Chair Boyd,
Aye.
Alderwoman Tyus, Alderwoman Schweitzer. We have 3 aye votes.
Thank you so much. And so now who do we have for who do we have on the call for that's for the mental health board? Madam Clerk, who are the people that are here?
I have on the attendee side who wanted to, I believe is raising to speak in regards to the mental health board, Annalise Stover.
Okay. So she was the recommendation from the mayor's office?
No, this is just for wanting to speak on the senior services. For questions and comments.
Good morning. I apologize. My comment was actually directed to Mrs. Stevens. Is she still available or has she left?
No, ma'am, she's left.
She's left. Okay. Sorry, I apologize. I raised my hand while she was speaking at the end and then the emergency happened. So I'll just send some information to Alderwoman Boyd. Thank you so much.
You're
Thank
welcome.
you.
Thank you.
So everyone that we have here to speak on the mayor's appointees, who I'm seeing online is only Julia Lopez.
Okay. Okay. All right. So Ms. Lopez, could you raise your hand, please? Your right hand, please. Do you swear to tell the truth, the whole truth, and nothing but the truth?
Yes.
Okay, thank you. And so Ms. Lopez is recommendations from the mayor's office to sit on the mental health board. And so I'll allow her 3 minutes to speak to tell about why we should vote to keep her on there, or is she is a new member. Ms. Lopez, you can go.
Sure. Thanks, everyone. My name is Dr. Julia Lopez. I've been on the mental health board since January of 2020. I work at WashU School of Medicine and Infectious Diseases. And I'm a licensed clinical social worker. So I've worked in community mental health for 20 years. And a lot of my work is in relation to immigrants and refugees, and also queer and trans individuals who are impacted by persistent severe mental illness, as well as at the intersection of infectious diseases, predominantly around HIV in particular, and advanced HIV. On my time in the mental health board, I've predominantly been involved in the programmatic committee. I've been the chair. Presently, I'm the treasurer and secretary of the board, the exec board presently. And really, I think for me, being able to kind of work on the grants, grant reviews, supporting organizations, both grassroots and community to larger entities in our city, has been something that I've enjoyed greatly. I think being able to see kind of the clinical capacities and the community work that's happening, being able to support that through the funds of the mental health board and having some say in how we structure those is something that I've been enjoyed for a number of years now. So ultimately, I just am looking to continue that work, and as I continue the work I do in my day-to-day.
Okay, thank you so much, ma'am. And so, I'll go to committee questions. And so Alderman Balmer, do you have any questions or comments?
No questions. Thank you very much for your past service, and we look forward to working with you in the future. Thank you very much.
Alderwoman Sonia?
No questions. Thank you so much for all of your work. I'm really excited, especially for the grassroots perspective and experience. I think that will be of, great benefit to the board, and I look forward to supporting you today.
Okay, and so on that, I have no questions or comments right now. And so probably what I normally do, I revisit the meeting and I might call you later or email you some questions if I have any. So thank you for being, and thanks for your patience through our emergency. So we appreciate that. And so on that note, I'll ask for a vote for Miss Julia Lopez to be appointed back to the Mental Health Board.
Looking for a motion? I
Yep,
move.
motion.
A motion. So moved.
Second.
Okay.
Previous roll.
All right. So Ms. Lopez, congratulations. You have been appointed back onto the Mental Health Board, and we look forward to working with you.
Great, thank you so much. Everybody have a nice, maybe calmer day, yeah. So, for those at City Hall. All right.
Right. Thank you so much.
Thanks, bye-bye.
Bye-bye. And then we didn't have any written testimony or anything on the candidates, did we, Ms. Clerk?
I have all of the candidates' resumes, but no written comments.
Okay. Do we have any announcements? Okay, no announcements. Excuse alderpersons or Alderwoman Sharon Tyus and Alderwoman Ann Schweitzer. Am I correct? Those were the two that were not present. Okay, so
Correct.
excuse absence. Then I ask for a motion to adjourn the meeting.
So moved.
All right. Thank you all so much. Great meeting.
Thank you.